What's going on, everybody? It's Dr. Pearlman checking in on a Monday morning, first thing, late May. Here we go. I wanted to make this video because it had been on my mind in the last few weeks, and I think it's something that really needs to be shared. And what that is people will tell me all the time, oh, it feels really good to hang from a bar. Look at that. It feels really good to hang from a bar. I'm decompressing, I'm doing my own decompression, I'm hanging from the bar. Look, I know how good this might feel some of the time, but if you keep having the reoccurrent back pain and you're like, oh, I'm hanging from the bar, like, is this good for me? Aha, okay, now we're getting to something. Now we're getting somewhere, right? Person comes in who's been having reoccurrent back pain and they're actually asking me, doctor, chiropractor, right? The chiropractor, please tell me, is hanging from the bar good? Here's what I'm beginning to realize. If you're having reoccurrent back pain, which let's just assume we know it's not a pulled muscle or tight hamstrings at this point, because it's probably not. It's more than likely a disc problem in your lumbar disc from chronic damaged annular fibers that lead to a level of either a disc bulge or a disc herniation. Let's hope it's actually potentially some nucleus that will one day get resorbed is a proper term. Because the bigger the disc herniation, the evidence suggests that it actually does resorb and it breaks down and kind of goes away over time. But the smaller disc bulges that take up 2, 3, 4, 5 millimeters that encroach into what they call the intervertebral foramen on the nerve roots, they're pretty damaging. They can be troublesome. And those actually respond well to decompression. However, those respond well depending on where it is in the canal, whether it's more central or lateral, is the determining factor sometimes about which decompression might feel better. So I'm going to end it with this. There's 3 components of things that you should never do if you're trying to protect a disc in your lumbar spine from getting damaged. Well, the first is reaching, the second is bending, and then the last is turning. And all 3 together, reaching, bending, turning, is how you'll hurt your back, especially in an inflamed or active state. Getting into how to control those or avoid those or work or to progress towards being able to tolerate those moves better is a whole different spectrum of conversation and is so, subject to, you and your condition. So to top it all off here, what are you doing when you're hanging from a bar? Well, you're reaching. You're lengthening and putting tension through the thoracolumbar muscles here, embracing and tightening, and maybe even pulling up on that piece of lateral disc protrusion or herniation or bulge to where it's really doing a lot more damage than it's helping, even if it feels good temporarily. Now, is a different kind of decompression going to be better? Maybe. Certainly passive and not active movement, right? If someone's doing it for you, and of course, getting adjusted is also, again, a whole other conversation about how that is or isn't good for the disc. So I went on way too long here, but I just wanted to tell you, hanging from a bar is one of the 3 components of what will actually exacerbate a bulging or herniated disc. Therefore, I am now, at this point in my life, going to advise you strongly actually not to do that if you are trying to rehab an acute disc flare-up, or in general, an acute lower back exacerbated symptom, or in general, if you have a bad back and you've been doing this all the time, you should probably stop. There's my 2 cents for this morning. Happy Monday.